We turn now to the White House COVID-19 response coordinator, Jeff Zients. Good morning and happy 4th, Jeff. Thank you for being with us.
Good morning, Ed, and happy 4th.
Yes, and we've come a long way since the last July 4th. And, you know, a lot of it is a testament to science. But should we really be declaring independence right now from the pandemic?
With so many people now vaccinated, tens of millions of Americans can now return to life, more normal life, getting together with friends and family, going to restaurants, attending sporting events. Now, to be clear, that's not true for unvaccinated people. Unvaccinated people are not protected. So we have a lot more work to do across the summer months to reach unvaccinated people, make it easy for people to get their shot and their second shot, and to answer people's questions. And key to answering questions are physicians and other healthcare professionals. So increasingly we have vaccines in doctors' offices. If you're not vaccinated, you're not protected until you are fully vaccinated. And until you are fully vaccinated, you need to mask up and follow the public health standards. But the great news is so many Americans are now fully vaccinated and can return to life as normal, and that is worthy of celebration.
Well, what specifically are you going to do to get those unvaccinated Americans to actually get a shot? According to the CDC, 36% of those eligible for that vaccine, more than a third of people 12 and over, haven't received even a single dose. What has to be done specifically to get those people to get a shot?
The good news is across the last several months, we've seen an increase in vaccine confidence, more and more people wanting to get a shot. So that's good news. Now we need to make sure that we meet people where they are, make it really easy to get a shot. Meet people at sporting events, at places of worship, deploy mobile units to reach people in their neighborhoods. We also have to be available at a local level to answer people's questions about the vaccine, about safety and efficacy. So we are ready to answer people's questions and give them their first shot. We're going to continue to do this in a fair and equitable way so that we reach all Americans and we vaccinate as many Americans as possible across the summer months. One
of the more troubling aspects of this is now the partisanship of getting vaccinated. A new Washington Post poll out this morning reinforces that 86% of Democrats have received at least one shot of the vaccine compared to 45% of Republicans. But 38% of Republicans, more than a third of the GOP overall, say they will most definitely not get shots against the virus. How do you take the politics out of this?
Well, I think President Biden has been very, very clear from day one. This is about public health. This is not about politics. And we need to continue to reach people where they are and answer their questions and have trusted messengers at a local level. The good news is as people see their friends and family and neighbors get vaccinated, more and more people get vaccinated. Also, think about close to 90% of seniors now with at least one shot. That's so important, as I said, because that is the most vulnerable population. And at the same time, clearly at 90%, there are people from all parts of America, political parties and beliefs. So we need to make sure that we continue to build on the progress we've made to build vaccine confidence, to make it even easier for people to get vaccinated.
At the same time that you're urging local officials and athletes and doctors to take up this issue and to promote vaccinations across the country, the federal government's now preparing to send in surge response teams to these states that are having outbreaks, especially of the Delta variants, especially the states out west and in the south. Talk to us a little bit about what those surge response teams are, what they're going to do, and does that potentially either affect or help getting people vaccinated if the federal government is sending in officials?
Well, we're working with governors and state and local officials, particularly in those areas where we see increases in cases. And those are generally areas where they have lower vaccination rates. So the federal government stands ready with a whole of government effort to work with local officials to increase vaccinations, to provide increased testing, and also therapeutics to ensure that people don't get sick who have contracted the disease. So we're going to work with our state and local partners, particularly in those areas of the country with lower vaccination rates, to make sure we're doing everything we can to stop the spread of the disease.
Real quick, if I'm somebody who's been vaccinated, if there's someone watching this program who's been vaccinated and curious, Do they need to get a booster shot this fall with their flu vaccine?
That is a question that's being studied in clinical studies. We will look, the Biden administration will look to the scientists and to the doctors on advice on boosters. That has not been determined yet. What I can tell you, if boosters are needed, we are ready, as we have been throughout this fight with the pandemic. We have contingency plans, we have supply. So if the decision is made that boosters are needed, we are ready, but that decision has not been made by the scientists and the doctors.
And you don't have any sense of when it will be made?
It'll be based on clinical trials that are ongoing, and as soon as the doctors and scientists determine they have the data they need, they'll make that decision.
Jeffrey Zients is the White House COVID-19 response coordinator. We thank you for spending part of Independence Day with us.